Hi, my name is Victor, and ever since the year 2007, I've been on a little mission to try to spread the word as much as possible about a piece of technology that can do a couple of things. It can save people's lives and improve the quality of their life should they be stricken with a sudden illness or disease, which is what happened with me in 2007. In the year 2007, well, first of all, before I get into my story, let me go ahead and tell you that first I'm going to give you a brief summary of what happened to me, my experience with the CyberKnife, and then I'm going to show you 3 videos. 2 of those videos will have patient stories, and one of the other videos will have a doctor speaking. And I'm trying to give the CyberKnife as much good press as I possibly can because it has totally changed, it has totally enabled me to continue living a very normal life as though nothing happened to me. Now, in my specific story, I was diagnosed with prostate cancer in late 2007. I spoke to my older brother who told me some of the side effects of having prostate removal surgery. And I did not want to go through those side effects because they were very, very ugly. Actually, because I was living such a normal life at the time, I didn't want it to be interrupted by having to go through that surgery, because just recovering from that surgery in itself was like having a disease. And and in 2007, not one doctor or physician actually recommended the CyberKnife to me. Not that I recall. I found the CyberKnife by doing research on the web, and fortunately, there was a CyberKnife. There was a CyberKnife within 30 miles of me. I live in Charlotte, North Carolina. There's a CyberKnife in Carolinas Medical Center in Concord, North Carolina, which was driving distance. So, to sum it up in a nutshell, my the CyberKnife, first of all, generally speaking, the CyberKnife delivers aimed radiation at very specific points of the body. So at specific targeted areas of the body without radiating the entire body. Well, with minimal side effects or sometimes no side effects. And in getting my prostate treated, it went like this for 5 days in a row. I would get up early enough to go to work and stop off to get treated for 45 minutes on that day, because each day was 45 minutes and I had to do that for 5 days in a row. And after laying down for 45 minutes, completely dressed without being cut or operated on, just having to lay perfectly still and remaining dressed 100%. Whatever clothes I wore to the hospital, that's what I kept on. And then after I got up, after 45 minutes, then I would continue on to work. Then I would go home. And coincidentally, there was no interruption in my intimate life between my wife and I as a result of going through the CyberKnife. Now, remember, the CyberKnife was treating the pelvic area of the male body in my case, and it did not interrupt our intimate lives at all. I was very surprised at that. As a matter of fact, I was to the point where I almost became paranoid because I felt like it should have affected me. It should have done something to me, but it didn't have any detectable side effect that I could find, or that the medical staff that attended me could see either. Um, but that's my story in a nutshell. And again, that was in 2007. And here in 2016, in the past 6 months, I have actually met a gentleman that has gone through prostate removal surgery, and he did suffer, in fact, the the side effects of erectile dysfunction and incontinence, and and he told me that no one even mention anything like the CyberKnife to him, and I'm very surprised at that. That's why that's part of my motivation for giving the CyberKnife all of the positive press that I can give it. And once again, I'm in Charlotte, North Carolina. The CyberKnife facility that I went to was in Carolinas Medical Center. And you see the address right here. It's 920 Church Street, Concord, North Carolina. And the phone number there is 704 403 1577 or 800 575 1275. And now on with the videos. Okay, now in this particular video, this is a gentleman at Colorado CyberKnife going through his CyberKnife treatment. And it's almost identical to the way my treatment went. You see the robot is getting in position right now to wherever they programmed it, or however they programmed it for his particular case. In each person's case, you lay in a certain position and the machine is programmed to treat your specific body. And I'm going to show just a portion of this treatment and talk through part of it. And the robot you see is now pointed at the patient, and the robot will begin to move and rotate around the patient. It shoots radiation. No matter what direction it shoots the radiation from, it's still shooting at the prostate. The prostate in this particular patient is receiving, his prostate is receiving 100% of the radiation, no matter what direction the machine shoots from. And the reason that it rotates is so that in order to get to the targeted area, the beam must, by necessity, penetrate some other layers of the body. And to minimize or eliminate side effects to other parts of the body, it rotates so that no part of the body receives the same radiation as the targeted area. And you see the machine now is rotating, is moving. And right now it's above the patient. Eventually in this video you will see the machine rotate and move to go below the level of the table. Now it's shooting from the patient's right hand side, and I think next it's going to go even further down, but still on the right hand side. And it's worth repeating. I'll say it once again. I assume that these are the clothes that the gentleman wore on his way to his treatment. In my case, for example, whatever clothing I was wearing, I was able to keep it on, and I just laid down for 45 minutes. I had 45 minutes. I had to give the machine 45 minutes each day for 5 days in a row. And after the 45 minutes was up, I would continue on to work. And after work, I would go home, and my wife and I could do whatever we felt like doing, whether recreational activities or whatever. There weren't any limitations on what I could do that I can recall. And I think we're getting near the end of this particular video. Overall, this whole presentation, I believe, is going to take approximately 20 to 30 minutes. And now you see the machine, the CyberKnife is shooting. It is below the table and it's shooting up at the patient's prostate, up into the targeted area. And like I said once earlier, it got to the point where I wasn't sure that I wasn't confident that the CyberKnife was doing anything to me, or if I wasn't confident that it was being successful, because I felt no different. And I mentioned it to my wife at the time, and we discovered that there was no interruption in our intimate lives. And I was very, very fortunate. I mean, it was unfortunate to have the to have to have the disease that I had, but it was I feel fortunate that the CyberKnife was available to me. And this is the end of this particular video. Now I'll move on to the next one. In the next two videos, I will not be speaking. The people in the video will be doing the talking.
I was afraid that I would not see our children grow up, get married, have grandchildren. I mean, just think about things that you just take for granted every day. I just kept, going back to the fact that this can't be happening. And after they diagnosed me, I had a lumpectomy and a mastectomy. The hope was that she was cancer-free and cured, and she remained without evidence of any cancer recurrence until December of 2008. And as we often discuss with cancer, different cancers have different time course over which they have a risk of recurrence. Some cancers, if they are going to recur very quickly. Other cancers, such as breast cancer, prostate cancer, we're very hesitant to use the word cure with those patients until at least 15 years or more following the diagnosis. So unfortunately, Mrs. Stewart had been approximately 14 years since her diagnosis when she presented with chest pain. I was at work and I was feeling some pain in my chest and in my arm, tingling and all that. And of course, after reading everything, you just think like, oh my goodness, it's a heart attack. So I called my doctor and she set up all the tests and things. And that's when we found out that I had metastatic breast cancer on my sternum. So it was like reliving the past years, but this time I'm thinking, my number's really up now. So when she was initially diagnosed with her recurrence, she began chemotherapy under the direction of Dr. Generosa Grana here at Cooper, in the hope to not only treat the cancer that was detected, but also potentially eradicate any other cells prior to detection that could be present. When we first went over the first treatment plan, it was to get chemotherapy. And I did get that, and I tolerated it well, and then the cancer went away. And then 7 months later, it came back again. So then Dr. Grana said that we're going to have to be more aggressive. So we decided on chemo again, and she suggested that we do the CyberKnife. I have heard of CyberKnife, and I've seen it on TV, but I didn't think that I would ever be one to utilize it. And after seeing Dr. LaCouture, and she explained it, and they took me around to see the facilities, which are incredible. CyberKnife treatment is a modified linear accelerator, as you can see behind me. The way that CyberKnife works is delivering multiple pencil-thin beams of radiation, often from more than 50 to 100 directions, depending upon the tumor type, all of which meet at one focal point to deliver very high dose to that area, but with each individual beam delivering only a small amount of dose to the normal surrounding tissue as it gets to where it needs to go. My treatment was about 90 minutes each time, and of course it's a very soft bed, and they put your vest on you, and they play the great music, and this little robot, or big robot, just comes around, and you see, it's almost like a Star Wars thing, because you see all these beams shooting all over the place. Mrs. Stewart's only persistent lesion identified on PET scan was in the upper section of her sternum, the breastbone in the center of the chest. We then developed a treatment plan for her that allowed us to deliver 3 CyberKnife treatments, delivering approximately 8.5 units per treatment. That overall, when we look at the comparative dose, it allowed us to finish what would have been the equivalent of nearly 5 weeks or more of radiation over the course of 3 days. After 90 minutes, you were out of there. You were totally out of there, and you were free to do whatever you wanted. And I left there with feeling uplifted. I never at all felt like I was getting any kind of serious treatment. Some of the tests are worse than getting a CyberKnife. And I was coming out of there like, there's something seriously wrong with me. I don't feel like anything's happening. They're playing great music for me. I'm singing on the turnpike going home, so it was a very great, really good experience.
Mrs. Stewart, at this point, thankfully, is doing well. She has a wonderful quality of life and a wonderful outlook on life. At this juncture, she has no evidence of abnormalities on her PET scans. However, we will follow her very carefully so that if she were to develop an additional problem, we're right there to try and offer her whatever the most appropriate option would be.
It's unfortunate that I have cancer, but it's very fortunate that I have Cooper because it's a family type. Even my regular doctor is from Cooper. So, I mean, I'm so fortunate to have them.
Okay, now in this particular video, remember this woman had metastatic breast cancer, and the CyberKnife successfully treated it. And she went through her therapy for 3 days in a row, 90 minutes per day. Now my treatments were 45 minutes per day for 5 days in a row, and hers were 90 minutes per day for 3 days in a row. And yet still she talks about how she was feeling. She was very similar to my treatment plan in that she was able to drive to and from her treatment each day. And that's absolutely fantastic. Even though the cancer in her body had metastasized to other parts of her body. I think that's absolutely phenomenal. And this is a huge motivation for me wanting to get the word out about the CyberKnife. Okay, now on to the next video.
My C3C4 vertebra. A chordoma is a rather rare tumor. They don't know what causes it, and it's generally malignant. It can metastasize, and also it has a tendency to wear away the bone. And one of the things that makes it so bad is not just the fact that it's cancer, but where it is. So my particular tumor was wrapped around my vertebral artery. So even more than cancer, the issue was having a stroke at a very young age. I was 29 when I found out that I had this. Not really at an age when I was expecting to have cancer. Well, I actually really feel like grad school took a bigger toll on me than cancer. And that says a lot for CyberKnife. I think that my experience with cancer was so much easier and so much less traumatic because of CyberKnife than so many other people that I have talked with. My husband and I had named my chordoma Jerry. So Jerry was now under attack. My job, even though I'm a teacher, you might not think that's the most active job, it requires me to be very active, just short of singing and dancing. And you know, it works. All my stuff works, which is good because it didn't work before, and it used to hurt, and I don't hurt. I asked my doctor about what would have happened if I hadn't had CyberKnife, and what he told me is that what he would have done surgically was to remove 2 of my vertebrae, just completely remove them, build a cage, plant a bit of bone because bone grows, and then they would have had to grow back. That is traumatic surgery. To be honest, my experience was actually kind of cool. I mean, I had one of the truly cool treatments, and it worked, and I think things could have been a lot worse, especially had they gone with surgical resection. Can you imagine your spine? When I found out about my cancer, I was, at the time, studying to be a commercial pilot. My diagnosis changed all of that because to be a pilot, you have to have your medical. You have to have a Class A medical. And with the threat of stroke and cancer hovering over my head, there was just no way I was going to be able to get a Class A medical. If I had known that CyberKnife would be so successful and that it would be so non-invasive and so not traumatic, I might have continued down that path. Had there been surgery, completely out of the question. The years that it would have taken for me to basically grow my spine back, and I mean, I might be on disability. As it is, I think things turned out for the best. I'm in a field that I love, and I feel like I'm actually a lot better off than I would have been before. The people at Georgetown with the CyberKnife, first of all, they were really interested in what they were doing, and I always feel better when people are interested in what they're doing. And second, they were all so nice. So for 5 days, I did that. I was tired, I'm not gonna lie. I don't know if it was because it all happened so fast. A lot of it was psychological. That was probably the only side effect I really had at the time was fatigue. I think that one of the greatest blessings that I got from CyberKnife is that I don't live like a person who survived cancer. I just live.
Okay, and that was another CyberKnife success story. And she spoke about what her surgeon would have done had she not gone through CyberKnife. Well, that reminded me of the fact that I spoke to a surgeon that wanted to operate on me and actually cut on me to remove my prostate. And after being told about what the side effects were, I decided that I desperately searched for an alternative. And very fortunately, I was able to find the CyberKnife. So I got cured basically, I got basically cured of my cancer without having to be cut on. Just like these two ladies that you saw here. They were their sickness was destroyed and they were not cut on at all. They were able to continue to lead their very normal lives. And let me see, there's something else I want to show you. And okay, once again, this is a photograph of myself, and I want to again share the information about Carolinas Medical Center, CMC 920 Church Street North, Concord, North Carolina, 282025. The phone number is 704 403 1577 or 800 575 1275. And if you go to cyberknife.com, they have a tool on their website where if you enter in your zip code, you can find out where the closest CyberKnife facility or the nearest hospital that has a CyberKnife facility is. That is the most efficient way that I found to find a CyberKnife facility. Excuse me. Well, thank you for watching this presentation, and I hope it will help someone.